entire crisis. Dr. K.K. Aggarwal is former president of the Indian Medical Association. He's with us. Rinchi Sharma, consultant in Mansa Hospital, and Dr. Sushil Sinha, president of UP Nursing Home Association, live with us too. Good evening, Dr. Aggarwal. Good to see you once again, sir.
Namaskar.
How confident are we, Dr. Aggarwal, of what has been approved by the American authorities today?
I think it's a good news, but the most important thing is now our effort has to be on reducing the mortality more than diagnosing. Diagnosis today, we are very clearly, clinically, we are very sure how to diagnose a patient even if the test is not available. The cases are very clear. Our job has to be more on reducing the mortality than on the testing. But yes, the testing is important from a public health point of view, and rapid testing is very, very important from that point of view. But for a patient management and a patient treatment, even symptoms are sufficient for us.
Okay. Virenji, in the last few months, we've seen in Hyderabad itself, there are 3 companies which are really racing against time to produce a vaccine. Now comes this new potential solution in terms of dealing with the corona pandemic. What do you make out? What do you make out of the US attempt right now?
We can call it as one of the game changers right now, because getting the result in 15 minutes is going to make a very big change. And even if we look at the sensitivity or the specificity of this test, we have high numbers, almost around 97% of sensitivity is a very good thing, because right now what happens is, in the hospitals itself, let me tell you, when somebody walks into the hospital with any other health issue, now the hospital sometimes deny taking that patient. The hospitals are worried if he has, the COVID-19, or probably when people are walking into a restaurant, or when the malls are going to open, when people are going to walk into the malls. At this point, having a test like this is surely going to play a big change in identifying the cases. From the beginning, we all know that how important it is to identify. Early identification has been the key, and in such a condition, if a test like this at a very cost-effective price, like you said, getting a test at 400 rupees is going to be a huge game changer for somebody who cannot afford the other tests. And especially, like you said, in Hyderabad and Telangana, we have seen issues where tests were not being taken by the private labs also, because they did not have the manpower, and thousands of tests were pending. So a new test was getting delayed by almost 2 weeks. So in such crisis situation, this is surely going to be an important aspect.
Dr. Sinha, I agree that in these crisis situations, any solution, any ray of hope will ignite a million dreams and a million senses of hope and prayers. But tell me, in a country like India, sir, where the number of cases today exists, and some serious questions being raised about the quality of testing which is going on in our country, this quick and reliable form of dealing with a virus about which we are still only trying to understand more, do you really subscribe to this feeling, Dr. Sinha, that if this was to be produced on a mass scale, then we will end up coming up with a solution to figure out exactly who's positive and who's not?
Exactly. Good evening, sir. Presently, we are approximately 33 lakhs total cases. Out of that, the active cases are approximately 7 lakhs. As far as death toll is concerned, presently in India, it is approximately 60,000. So, in a country having a population of 120 crores, death toll of 60,000 in a period of 6 to 7 months is not a high death toll as compared to other nations. But still, the way we are, government is focusing on the testing. The more the testing, the more the cases will be identified. And if we are able to just control the death toll, then we will be able to control the COVID also. Because the main point is the death toll.
No,
the death in the COVID.
Yeah, no, I agree. No, of course, I agree. I agree that the main point is the number of people who are being impacted, and of course the death toll. I was only trying to understand that at a time when when the 2 kinds of testing which have been allowed in India, that gives you 70% accuracy rate. Now there is this third testing potential that we are looking at in America? Purely from a medical point of view, how seriously should I be looking at what is being proposed by Abbott Laboratories?
Exactly. As far as the testing is concerned, the RT-PCR is the gold standard. That is the best. And as far as antigen testing are concerned, for the screening purpose, we need to have antigen testing. And all those patients who are symptomatic or who can become positive in those screening, they can be given for a RT-PCR testing. So in that way, our resources will be not consumed, and as far as the high population that we have, so in that case screening is a must.
So I want to add, Bhupen,
Yeah.
I want to add,
Dr. Aggarwal, Dr. Aggarwal, let's look at it from the FDA in America, and I was talking to some medical professionals in America. There are some questions being raised about the efficacy of FDA, which is why I'm repeatedly pointing out, because I don't want our viewers to feel that suddenly we've got something which will work in 15 minutes. You spend $400, and a month down the line, you'll end up getting a solution. How seriously do I look at what is being proposed by the FDA at this stage, Dr.
no, I want to talk about a couple of things. One is, it's an antigen test, it's not checking the gene. RT-PCR is checking the gene and not, it's checking the RNA and checking the gene and not the antigen. Antigen tests are always screening tests. Their false negativity can still be high, number one. Number two, most important thing in a test is, when we do a screening test, whether it is 15 minutes or 20 minutes, remember the Delhi Sero Survey. Delhi Sero Survey says that 30% of the population has already developed antibodies. If these tests were freely available, those 30 lakh people, if you would have done the testing, was that important, or reducing death is important? What I am trying to say is, sooner or later, 67% of the country is going to get infected. Are we interested in finding out who is asymptomatically positive or not? We cannot. At the moment, my emphasis as a doctor is to reduce the mortality and nothing more than that. Asymptomatic people, picking them up, the time has gone. Now we have gone beyond that phase of restricting the illness. In a country like, in a city like Delhi, where 30% of the population has already been affected, these tests, yes, they are valuable if you are getting admitted in a hospital. So these tests will be of a value of admitting a patient in a hospital to check whether they are positive or negative. These tests will be of value whether you are admitting a patient in a pre-surgical ward, delivery ward, but not in a routine care. In a routine care, a patient is asymptomatic, doesn't matter, he can wait for a couple of hours to get the test done. So yes, definitely, sooner or later, this test has to become like a hemoglobin, it has to become like a pregnancy test, it has to become like even saliva. That the industry is going to boom in the next 2 months with such types of screening tests. People will come back with a screening blood, screening sputum. All these testings will be available, and they will be further cheaper. They will be available in a person's clinic. I agree with them. But my game changer will be when I reduce the mortality further. Testing, yes, it's a game changer, but it's an economical game for everybody. I am more concerned about the reducing mortality.
Virenjiji, on one hand, the true fact is that the number of positive cases in India is where it is, and we all know this. But to Dr. Aggarwal's specific contention, that our focus has to be on ensuring lesser number of deaths. You can ensure that there is lesser number of deaths if you get hold of people in time. Now, I want to know whether enough attention is being shown in India and through Indian innovators and Indian laboratories to figure out exactly where are you in this battle against COVID. What, is there enough attention? Is there enough research which is being done to ensure that we can also think in terms of producing innovative solutions like what Abbott Laboratories is talking about, just to figure out, not the solution, but just to figure out whether you're positive or not?
Well, undoubtedly research has been happening, but the problem is it is too early with the kind of manpower and the infrastructure that we have. I think it's a little too early for us to start off something like that, and it is unfortunate. I mean, proud of all the medical professionals I'm myself a medical professional, but the infrastructures that we have or the facilities that we have has not been enough. So somewhere a test like this is going to be helpful. Actually, agreeing to what Dr. Aggarwal sir has said, this is more like a pregnancy test which you can easily avail so that we can understand where we are as an individual. But at the end of the day, the RT-PCR test has to be done. So maybe a little bit of quality of life is something we are looking at with a test like this, but we are not looking at solutions for sure. And we do have, the potential to come up with something like this. And there are multiple tests coming up like this. Like Dr. Aggarwal was saying, the Yale University is looking at bringing up a screening test with the saliva, which is still more easier than the current Abbott Laboratories test, because here we still need somebody who's trained to do it. But the saliva test is all the more easier.
All right.
But these are only going to be screening tests, and screening is only going to rather improve a bit of quality of life in a pandemic situation like this. But it's not going to be a game changer.
I just want to add, Bhupen, that this
All
is
right.
this is
Gentlemen,
the
I'm just hoping that
I
this
just want to add.
battle against corona pandemic, at least for us in India, it's a battle which we have to win. And we need to figure out whether it's this Abbott laboratory or it's what is being proposed in India. Some laboratory needs to give us some hope, some solution, because it can't be. I mean, so many people around me who tell me that now they've just given up in this battle against corona pandemic. These are the things, folks, that matter. Wherever I go around in Delhi, people are now largely moving out without any masks. In Hong Kong, we've seen how there have been instances of a second wave of people being reinfected. We want to know about what's going on, these possibilities. We don't want to know about what's going on in the life of a film star. I really mean it, folks. The kind of disservice which is being done in this country today, simply because the media is just not holding people accountable, just not asking enough questions, not holding a mirror, it is adversely impacting your life, and it is adversely impacting my life as well. But thanks to all of you. Thanks to all of you for joining us. The other big story which has developed as part of our continued focus on southern parts of India is coming from Karnataka, where a rather